Facing cancer can be overwhelming. How do you stay informed about your disease? How do you get help from others in your situation? How can you become part of the cure? HealthTree Foundation is how. HealthTree is a global nonprofit organization uniting patients and researchers through cutting-edge technology to work together on curing disease. HealthTree is already accelerating cures and is actively expanding its reach into all blood cancers. The HealthTree model is simply powerful, with cure tools in 3 primary areas or pillars that deliver on its mission. First, personalized lifetime support and education. Second, meaningful patient-to-patient connections. And third, a powerful patient data portal. Our first pillar is lifetime personalized support and education. It's a fact that educated patients live longer and have better quality of life. That's why HealthTree has an in-depth library of webinars, podcasts, news articles, and even an online university where experts share their knowledge. Plus, you can benefit from a supportive team of bilingual patient and medical navigators. HealthTree's second pillar, meaningful patient-to-patient connections, enables you to learn from others and receive vital support and information along your journey. Through HealthTree's coach program, volunteer coaches provide emotional and educational one-on-one support. This program alone has changed thousands of lives, bringing joy to both coaches and coachees. The coach program is available for our multiple myeloma and AML communities and will be coming to all other blood cancers soon. HealthTree has programs for underserved communities as well, providing equal opportunity for everyone to receive the very best medical care. HealthTree also offers regional cure teams, where you can connect with caregivers and other patients, learn from local specialists, raise awareness in your neighborhood, volunteer to support your peers, and fundraise for research. Our final pillar, the powerful patient data portal, is called HealthTree Cure Hub. Built on proprietary technology platform, HealthTree Cure Hub enables you to track your disease by linking your medical records from various facilities in one place, see your integrated medical labs, and discover potential treatments, and even review clinical trial options. You can even find and chat with someone with similar disease characteristics, or uncover crowdsourced solutions for your side effects. Ultimately, you can be a key part of accelerating a cure by participating in active studies that lead to faster findings and deliver real-world evidence for blood cancer researchers. In fact, HealthTree provides researchers with the most comprehensive, accurate, and continually updated set of research data available anywhere today. HealthTree Cure Hub opens doors for new types of investigator research, saving time and money on the road to finding a cure. Today, 14,000 blood cancer patients participate in HealthTree Cure Hub, and 65,000 blood cancer patients have taken surveys. These 3 pillars support the miraculous work of HealthTree around the globe and help keep patients and loved ones connected as they become active contributors in finding a cure. The HealthTree model is working every day on behalf of patients. We are now expanding the successful model to accelerate a cure for all other blood cancers. So when you get your diagnosis and you're trying to make sense of your new situation, rest assured there's a way forward, a way filled with hope, encouragement, and results. HealthTree is the way to a better outcome and a better life. Facing cancer can be...
Hi, everyone, and welcome to today's webinar. I'm so happy that you're here. My name is Dalton Bean, and I'm the CLL Education Manager here at HealthTree. At the end of today's webinar, you'll have the opportunity to take a short survey. Please take a moment to fill this out. It really does help us. You can leave suggestions for future topics, as well as provide any feedback about how you thought today's event went. This helps a lot when we're trying to plan events in the future that the community really cares about. So I would love if you'd take a moment to do that. And then I want to give a shout out to our CLL Central sponsor. This is going to be AbbVie for today. They allow us to host events like this. So without their support, we wouldn't be able to do this. So truly, thank you to AbbVie. And I know that we're here for a financial event, but I wanted to let everyone know that HealthTree does have its own social media platform called HealthTree Connect. This is a really good way to join a social media platform that is dedicated for CLL patients. This group is designed for CLL patients and their families and caregivers. So it's just a really nice way to have more of a community feel and have conversation with people that really understand the position that you're in. If you're interested in HealthTree Connect, you can scan the QR code on the screen and it should take you directly to the CLL HealthTree Connect group. We are recording this event as well as live streaming on YouTube. The recording of the event will be sent out in a couple of days to everyone who registered. So be on the look out for that in your email. As we go along, if you have any comments that come up or questions, feel free to drop those into the Q&A. We'll do a dedicated Q&A at the end, but I know sometimes things can slip your mind as you're listening, so feel free to drop them as we're going along. If you need any help with Zoom, please feel free to also post that in there, and we'll be able to help you. And today we are going to be talking with Diana Valentine. So Diana Valentine is the Financial Advocacy Program Manager here at HealthTree. She is specialized in helping those with blood cancers. She is a professional financial advisor and former caregiver for her husband, who is diagnosed with multiple myeloma. And she is a wonderful asset, and we're so happy to have her joining us today. And our topic today is going to be managing the associated costs of CLL. So, Diana, thank you for hopping on and joining us today.
Hello to everyone. Can you hear me?
We can. We can't see you yet, or that
Yeah.
could be just on my end.
There, oh,
There
there
you
I
are.
am. Hello, everyone. I'm talking to you guys from Louisville, Kentucky. I often get the question, where am I coming from? I live in Louisville, Kentucky, and we have a beautiful spring going on. A lot of rain today, but my grass really needs it. So, I know there's a lot going on with a lot of questions within our financial world, right? And money goes to everything. It seems to be it's the leading thing that we need to take care of our families, ourselves. And right now, the cost of one thing is going to affect what we can spend on other things. And one of the largest costs out of pocket is going to be either a home or healthcare. Unfortunately, when you have an illness like cancer, it seems to be the most expensive thing that you seem to be managing on a daily basis. There has been some studies done. I'm going to go through this later on in the screen about how much CLL usually costs per year and over a lifetime. And over a lifetime is getting expanded because we have more treatment, which means, especially when new treatments come out, the cost of them are very high, but it's expanding lives, which is wonderful. And that's what we want to get to here with HealthTree so that you can live your life and not have to worry about cancer. So let's go to the first slide. Here it is, the cost of treating CLL. In 2003, ASH presented a study on the lifetime cost of treating CLL, with drug costs being the leading driver. The research said that in the United States, the total lifetime of treating a patient with CLL was estimated to be $1,142,357. Okay, you can see that without the proper insurance coverage, a patient can become financially stressed very, very quickly. And it's not just for CLL. I'll tell you, multiple myeloma has a drug, one of their flagship drugs. It actually runs average $28,000 a month. If you don't have the right insurance, how can you possibly afford that drug? And that's just one of many drugs that people have to take. So I will review some options for you to consider to help you find additional financial resources to help you cover the cost of treatment. I'll tell you, when my husband was in treatment for multiple myeloma, I had no idea that these resources were out there. I wish I had. We came out of, I hate to tell you how much money we came out. Let's go over several million dollars. We came out of pocket for his treatment. And I got bills even after my husband was gone, 93,000, 1.3 million. It's very stressful. It's not fair. It really isn't. And in today's society, there's a lot of things going on with Medicare, with what may be happening with Medicare, with the Affordable Care Act, getting treatment, getting the right kind of insurance, formularies going off on and off of your insurance plan. So I want you to know there is help out there, and you just got to be diligent about getting it. Not just look one day and it may not be there, but you need to be diligent to find out where those things are and how do you apply. It's fairly simple. Next slide. So some of the things we're going to cover in this webinar is questions to ask your doctor. It's very important. If you don't know where you're going, what kind of treatment you're going to have, or what your treatment's going to be, possibly if you come out of remission or next year, if there's new drugs may be available, then how are you going to know how to prepare for those costs? Whether it's preparing for the right insurance, when and if you can change the insurance, whether it's Medicare, what type of Medicare plan to go into, what your plan D is going to look like, if you're going to do Medicare Advantage or a Medigap plan. So there's a lot involved in trying to decide, not just, what is this treatment going to cost, but you ask your doctor what is going on with your treatment. Are you going to change places where you get maybe some of your scans? Are they in network? So there's a lot to keep up on. But I found that if you have a folder or a notebook that says what your treatment is now and what your next option may be if you have to change your insurances, then you start planning and you have something written down so you'll know where you're going. So again, understand your insurance. What can your current insurance cover? If you're finding it is short, when can you make changes to your insurance plan? Understanding your medical bills. This is huge. What if insurance isn't enough? A lot of patients come to me with questions saying that, I have this new prescription. I found out it's no longer on formulary. How can I get it paid? Get it taken care of? How can I get help paying those bills? I will go over some of those things with you. What if you need to take time off from work? That's a very big question. A lot of people have to do that for their treatment, and some people need to take maybe extended times or just short bits of time to make sure they're in treatment. How can you protect your job? Where do you get financial assistance for prescriptions, copays, deductibles, and premium reimbursements? We're going to go over that. Next slide. So questions to ask your doctor. Here are some ongoing questions, and this is not an inclusive list where you can ask your doctor these to keep ahead of your expected costs, as well as making sure you can make changes to your insurance when and if eligible for the best coverage. These can be asked throughout your treatment. So questions to ask: can I get a second opinion, and will my insurance pay for it? It's very important. Some insurance companies will pay for not just your second opinion, they may pay for a third. Let's just say you have your doctor, oncologist, or specialist saying one thing, you get a second opinion and they're saying two different things. A lot of times your insurance will pay for a third so that you can get a third one that may match with one of the others, so you can get a best third, third opinion. And will a second opinion by in network or will be in network or out of network? That's another thing you got to watch, because if your insurance is in network for your first opinion and you have to go out of network for a second opinion, like a lot of people have to do if they don't have a specialist with them, is that going to be paid for? Whenever you talk to your insurance company, keep a copy, ask them to send you a copy of what they agreed they're going to pay. Because a lot of times you'll find that if you go somewhere out of network for some really weird reason, it was covered, but all of a sudden you go and get that treatment or that opinion, and they say it's no longer covered. If you have that copy of what they said they're going to cover, you have something to work with. So what will the treatment cost, and where will the treatments be given? Very important, in network or out network. How often will I need labs and scans that can help you determine what your copay's total out-of-pocket may be? When can I participate in clinical trials, and what are their associated costs? This varies, and as you know, there's a lot going on with clinical trials. Fortunately, the cancers have not been touched as much as some of the other trials. So I always talk to the plan sponsor. If you are currently in a plan and you're concerned about if it's going to continue, or if you're planning to get into a clinical trial, talk to your doctor about the associated costs, whether it be travel, lodging, or any additional tests that may have to be done during the period. Next slide. Are you eligible for a stem cell transplant and what is the cost? I'll tell you, costs can vary within a city. Costs can vary in different states, and costs can vary between insurance plans. Find out what they are ahead of time. Can you travel for any of your treatment? Is there any financial assistance? There is financial assistance for travel, for lodging, for food, for maintenance for a car, for gas for a car. There are options and resources available to you. Where can you get help paying for copays, deductibles, coinsurance, and premiums? I will go over those things here shortly. If you're hospitalized, can you get help paying for the cost of hospitalization? Yes, you can. In a lot of instances, and a lot of people are afraid to ask, they aren't, and they may not be told, even within their hospital, that there may be hospital charitable programs that are available to them to help pay for the cost of their hospitalization and medical bills, but they are out there. The next slide, please. So what is your insurance going to cover? The most important thing you can do is make sure you have the best coverage you can afford. Then understand your prescription coverage and your hospitalization coverage. If you're on Medicare, understand the new costs associated with coverage as well as deductible limits and out-of-pocket max. A lot of people think that their out-of-pocket max only covers a few things, but it's everything that you pay, whether you go in and get that prescription or something over the counter that helps support what you're taking. This is all a part of your out-of-pocket. I wouldn't say associated with your insurance necessarily, but the max out-of-pocket that you're going to have to be aware of to take care of your treatment, to manage your treatment. Get things in writing from insurance carriers again. The promises they say to pay, your responsibilities. Keep these records. Note the person, date, time, and whom you spoke to, because if you have an appeal or if something is not done the way they said they're going to do, you have something in writing that you can refer to. Don't pay bills without an itemized bill to complete to the EO compared to the EOB, which is the explanation of benefits. I went into a doctor's office the other day and they said, we're going to pay, you need to pay your total amount because we know you have a deductible of whatever it is, was $500, but we're going to pay as if you haven't paid your deductible. And I'm thinking, I've already met my deductible, but they're saying, so you can't get service here. Okay, so maybe you need to turn around and walk out and find another place if that's available to you, because you shouldn't be paying over your max out of pocket. If the bill is incorrect, challenge the bill. We found that there may be up to 80% of medical bills are incorrect. They are not incorrect to your benefit. It's always incorrect that's going to benefit that provider. So if you have to pay 10 or 20% of a bill, or maybe even more, and it's an incorrect bill that's higher than it should be, you're paying too much. More than 50% of people who actually appeal a bill get it taken care of and get it managed and corrected. So don't be afraid to appeal a medical bill. The next slide. So, okay, accommodations. Okay, where are we? Okay, so keep going back. Say approximately 80%, let's go back to the deciphering. Approximately 80% of medical bills, like I said, are incorrect. These mistakes can range from minor to significant. They can devastate families. Mistakes can be made in coding errors, duplicate billings, and bills for treatments that were never given. If you've ever gotten an X-ray, sometimes you may see two X-rays. Why is it saying two X-rays for exactly the same thing? That is very, very common. So what can you do? Don't pay a bill until you get your itemized bill and I'm sorry, there's a typo there, a copy of the evidence of benefits, or EOB. Don't ignore a bill either, because the longer you have a bill, it can go to collections. And even though medical bills, they say, are not in collections, as for medical bills that are $500 or less, anything higher can go to collections. So you don't want to hit your credit. Appeal the bills. Sometimes when you're appealing it, that collection time is put on hold. So make sure that you can do that. And sometimes if you pay a little bit toward a bill, or you come to an agreement of how much you can pay, then it will not go to collections. More than half of again, bills that are appealed can be corrected and changed. Next slide. Accommodations at work for those with a disability. This is a very touchy subject. Oftentimes it may be necessary to take time off, whether it's a short term or a long time, from work to manage treatments and symptoms. Knowing the appropriate person to talk to, this is very important, and how much to tell them is often a challenge. I will tell you now, you do not have to tell them that you have CLL or you have any other cancer. You can just say, I have to take time off for treatment. There are HIPAA laws. You need to be very comfortable with understanding those HIPAA laws. You need to be intimately understanding of those HIPAA laws so that you'll know what you have to disclose and what you don't have to disclose for your privacy. Know what your company offers its benefits. Have them know what the American Disabilities Act is, and you'd be surprised. A lot of companies are not aware of what American with Disabilities Act encompasses. This is a civil rights law that prohibits discrimination against people with disabilities in many areas of public life. Now, another challenge that we're finding with a lot of the new administration is some of these discriminations. There may be discriminations now against people with disabilities. So you have to be very careful. You have to be very diligent and make sure that you're talking to the right person and that you're giving them the appropriate information. This law should ensure equal access to employment, public services, public accommodations, transportation, and telecommunications. This act applies to all employers with 15 or more employees. If you have an employer with 14 or less, then they may have their own type of program to help people with disabilities. So this would include the 50 or more employees. This would include state and local governments, employment agencies, and labor unions. Please refer to the ADA.gov for answers to common questions. And again, with a lot of changes in the new administration and the uncertainties and questions regarding this, I would suggest you keep up with what's going on. The ADA.gov site should tell you what's actually going on, what changes may be happening. When I find a lot of things that are changing, it's going to affect our communities of blood cancer patients. I try to post that in our financial side, and sometimes it carries over to the other connection sites for the patients so you can be aware of what's happening that may affect you. So please do that scan and refer over, and a lot of this information will also go into CLL, your CLL Connect site. Next slide. So taking time off from work, there is FMLA. A lot of people are aware of that. That's the Family Medical Leave Act. And that's not just for the patient. It may be for a caregiver, like a spouse who may need to take time off to assist you in your treatment or your care. The Family and Medical Leave Act is a United States labor law that allows eligible employees to take up to 12 weeks of unpaid job-protected leave per year, that's per year, for certain medical and family reasons. It can be broken up into small bits, like if you need to take 2 or 3 hours for a treatment, or you need to take a day for a treatment versus taking the entire time at once. There are some other criteria around being eligible for that. That means you may have to put in a certain number of hours during the year before you can apply for that 12 weeks of FMLA. So be aware of what your company, if you're still working, offers. They usually have a employee book. You can call your benefits department, and they should be able to give you the information regarding the FMLA as well as ADA. Or for additional information, you can visit the U.S. Department of Labor.gov at www.doi.gov. Next slide. Again, what if insurance is not enough? This is the biggest question I guess everybody has. If you have the opportunity to change or to better coverage, a lot of times during the year, there's open enrollment for Medicare. Medigap has their enrollment periods, and I got to tell you this, I found this out just recently. If you have a Medigap policy and you know what your state offers and options they have, you can be disabled and prior to age 65, a lot of states will let you get a Medigap policy. Other states, it may be very difficult. But if you can get a Medigap policy in your state, you're under the age 65, you can change that plan. Let's say you got a plan G. That's one of the best coverages that Medigap offers. You can change that plan on your anniversary date. They don't want to tell you that, but you're able to do that. I would call your state health insurance program, it's called SHIP, and find out what your state offers with Medigap plans. Now, ask about hospital charity programs. I mentioned this earlier. If you cannot pay for medical bills or hospital bills, your hospital where you may have gotten treatment, especially if it's a nonprofit, they will have hospital charity programs. They are required to participate in programs like this to help people pay for bills. Ask about nonprofit assistance programs such as LLS, Leukemia Lymphoma Society, HealthWell, and that's to name a few. Contact your drug manufacturer if you've exhausted. A lot of times I've found that the drug manufacturers will require or request that you exhaust all of the other options that are associated with nonprofit assistance programs such as LLS HealthWell, copays.org, advocate program before you turn to them. Now, one of the other things I found is if you call a drug manufacturer and you see listed on their website, um, it has to be private insurance, contact them anyway. They may have a separate program for people who are on Medicare who are having a hard time getting their prescriptions covered. It does not hurt to ask what options they have available to you. Manufacturers and people who are need their prescriptions want people to keep coming to them. That is their business, and they want people to keep coming to them. So ask. Next slide. So are there any generics biosimilars available? That is a good question to ask if you have one of these brand name drugs that are very expensive. On the multiple myeloma side, that is the Revlimid and some of the Apromilast, some of the other drugs that are very expensive. Ask if there are biosimilars or if biosimilars are coming soon. A lot of times the biosimilars may also have financial assistance programs available to patients. So see if you can get prescriptions in a different form, maybe through IV versus a oral drug or oral drug versus a IV. They may be cheaper either way. You may be getting the prescription via pill form, like I said, and you may be having a hard time paying your copay. Perhaps the prescription available via IV is covered under medical insurance with better coverage and less out of pocket versus your prescription coverage, especially if it's falling off of formulary. Next slide. Where to find financial assistance for medications. Medications for cancers are expensive. We covered that. In fact, cancer medications are some of the most costly for any disease out there. The first line of defense in managing costs is to review your insurance every year, as many carriers change their cost sharing very often. In fact, I have found, and patients have called me saying that mid-year, they're finding that some of their prescriptions are falling off their formulary. Even though they may have signed up for that particular prescription plan because their insurance was covered, they're finding their prescription was covered, they're finding that some of those prescriptions are being dropped off. And that puts people in that's a horrible, scary situation because they're off treatment. So I would suggest you go to those LLS, HealthWell. I know HealthWell is open for Medicare access. LLS was open. Keep up with those. If you find those programs are closed, keep watching them because they may come back up. Or go to HealthTree's financial resource page to find many other resources that may be available to you. We have those out there that are listed. It doesn't just cover prescriptions or the nonprofits. It also covers goes resources for travel, utilities, things like that. So don't forget to reach out to the pharmaceutical company again who manufactures or distributes your medication. Many of them have patient assistance, financial assistance programs that can help you pay for your medications if you can't afford them. The next slide. Additionally, many of the pharmaceutical companies offer additional support for patients. They may offer educational support based on that prescription you're taking. Be aware that they have criteria for assistance as it varies between organizations. Some may not provide assistance for Medicare patients, but I would encourage you to ask. Again, ask. It doesn't hurt to ask. There may also be income caps to assistance availability. Generally, it's 500% of the federal poverty levels. And those federal poverty levels are based on income and the number of people in your household. Some pharmaceutical companies may provide medications to bridge the gap between insurance coverage to help you get on treatment as soon as possible. Let's just say the doctor said you need to be on, I'm going to use Revlin because I'm very familiar with it, and you have to go through prior authorization. Right now, it's taking a little bit longer sometimes to get those prior authorizations through. Your doctor's office can call the pharmaceutical company and verify, yes, that's what you're going to be on, and they could possibly get you your first month or whatever that treatment is covered for you so that you can start treatment, so that you won't have a lapse in one treatment to the other. So if this is an issue, alert your doctor or an oncology nurse navigator there in the practice. They may be able to assist you in getting the assistance you need. Next slide. The breakdown on patient financial assistance programs. When you receive financial assistance from nonprofits like LLS or HealthWell, or from the pharmaceutical company to help you cover the cost of medications, it is tax-free to you. You never have to report that on your taxes, no matter how many times you get it. And often those things are, you can get those renewed yearly as long as there are funds available. So you can get it, you don't have to report it on taxes. However, in most states, the funds you receive do not count towards your deductible. That is a big issue that has been in, legislation for a long time. And unfortunately, some of these things get pushed to the side because other things become more important in the legislation. But keep an eye on what this is going to be doing. If I find there's going to be any changes where that is not going to be the case, where whatever you receive for grants also applies to your deductible, I will let you know. Some states allow it to apply deductibles, most states do not. Next slide. Again, keep notes on everything. Organization is key in understanding the cost of your care, where it's going, if you need to make changes to your insurance. Keep your EOBs together to make sure that you're not going to be billed more than if you've already met your max out of pocket. Make sure your bills are correct. Ask for itemized bills. If you have any contact with providers or insurance companies regarding the cost of treatment, including prescription charges, make a note as to who you spoke to, the date and time and nature of call. If you have an upcoming treatment that's going to require you to be inpatient for a few days, ask around, find out if there's a better place to do it that may be less expensive, and also get an itemized bill from where you get that treatment before you pay. If you receive any grants, keep a notebook of whom you received it from and the date and when it can be renewed because they're renewable annually. Also note as to how the funds are being spent. For instance, if one nonprofit is giving you money for co-pays, deductibles, the other one you may be able to apply for another one to cover your premium reimbursement. LLS covers premium reimbursement for Medicare. So keep a list of those when they're going to come due so you won't have a lapse in that assistance. The next slide. Again, how often can you get financial assistance? Usually in nonprofits like LLS, you're going to reapply every 12 months. Just because you apply, you got to be aware of this, doesn't mean the funds are going to be available, but you need to keep up with what's happening with LLS because often they do open up when they have more funds available for patients. Receipts will be the receipt of your grant will be depending on available funds. Again, you may also apply to more than one organization, perhaps one for copay and the other for premium reimbursement. They will ask you most times what you need the funds for. In the case of HealthWell, if you decide where you want that money to go, you cannot go back and change it mid-year. So be aware of how much your out-of-pocket costs are going to be and the best way to use your grants. If funds aren't used in a timely manner, usually 60 or 90 days, when you submit bills or use your card, you may forfeit the remaining balance. So be aware of that as well. You can still reapply the next year. The next slide. Generally, you can apply for funds every 12 months. That's not January to January. If you got fund in February, then you apply January the next year for the following year. However, some financial assistance programs may be one-time grants, such as funds from urgent needs. And this is like the smaller grants. Urgent need with LLS is generally $500 in one time, and Catholic charities will usually have grants for $500. I know it's usually one time, but I've known people who go from one Catholic charity, they may go to another one, and for some reason they may get more than one grant. But be aware of local assistance that may be available to you. A lot of people forget you can call 211, and that gives you access to all kinds of local assistance programs that may be available to you in your local community. The next slide. Each nonprofit, as well as pharmaceutical companies, have their own criteria for applicants. They may require you not to be on Medicare, or they may require income verification and limits. Sometimes when you're doing this via the phone, for some reason, they can verify that over the phone at the same time. I don't know how they have access to that, but sometimes they can. They may require you to send proof of income via your tax return. They will also require your doctor to verify your treatment. The doctor's name, address, and phone number will be required, and they will send a form to your doctor. Oftentimes, this is where there may be a delay in you getting your grant because it may go to the doctor's office, it may sit on somebody's desk, and they may be or ignoring it, not by my intentionally, but there may be a lot of other things going on. I would suggest when you know that it's going over to your doctor's office for this grant, call your doctor, make them aware of it. And if you're going to be going in, ask them, can you go in and get that, or can they go in and send it in while you're there? They will ask about the type of insurance you have, meaning whether it's a federal program like ACA or whether it's through your employer or whatever. And if you think your income is changing during the year, let's just say it's 500% of federal poverty levels, and you know your income last year, which you're going to ask because you know you have the tax returns for that, it's going to be higher than this current year. Let them know that because oftentimes they may be able to accommodate that change in income, particularly if your income is going to be lower, that may give you more access to those grants. The next slide. If you have Medicare, can you still get assistance? We kind of covered this earlier. Yes, in a lot of cases you can. Again, ask that pharmaceutical company if they have grants available specifically for Medicare patients. Oftentimes they do. And then if they're not able to get that grant through one of the nonprofits, go directly to the pharmaceutical companies. Again, they may have their criteria, but oftentimes they don't want to lose you. So see if I would not call them if you see on a page Medicare or just employer or private care. I would still call that pharmaceutical company, and I would talk to that nonprofit as well. Next slide. When to apply. Unfortunately, the data is so great for people. That's why they run out of money sometimes very early in the year. They may open up later on the year. Apply as soon as you think you need it. The earlier in the year, the better. If they're closed, check back often as they may receive more funding for a program throughout the year. I know LLS has done that, HealthWell. They may run out soon, but there may be additional fundraisers or whatever they have funds available throughout the year. Because they will need to send a verification of treatment to your doctor, call your doctor's office to alert them that it's coming, and to encourage them to return it as soon as possible so that when you know the funds are available, you put in your application that it is returned and approved as soon as possible. Next slide. So these next 12 or 13 slides, I put this on there because now you have the information you need without having to search for it. Now, these are the drugs that treat CLL. You may be on one, two, or three, or maybe not be on any of them now, but they anticipate you going on some of these drugs soon. I have put the drug company name for that particular drug, their phone number, their email address, and the types of patient-assisted programs that they have. So I'm not going to run through all of these, but if you'll look at that, I wanted to put it on here so you can have access to that because anybody on this webinar has access to this webinar, and it's there, print it out, keep it in your folder. So we can go through these. Word to the wise. With the many changes, and please listen. With all the many changes, the uncertainty that's going on right now with the new administration, I encourage you to keep up with any changes that may be happening with the drugs that are on your formulary plan currently and what may change. Some plans, again, are changing their formulary drug coverage during the year, mid-year. You don't want to be stuck thinking you're okay. It's been fine for the last 5, 10, 15 years, so you're just going to assume everything's going to okay. Okay, we are in a different world right now. So I would encourage you to look at that. Another thing that's really pressing, I think that I want to talk to you about. A lot of the preventive care, and some of that means screening for cancer. A lot of those things they are on the chopping block as far as them being covered for insurance. That was one of the things that went through with ACA required for all medical plans through the Obama administration. But some of those things now are possibly on the chopping block for cancer screenings, for your regular healthcare screenings, preventative care may be on the chopping block. So as patients, I think it's very important for we advocate for ourselves. Call your congressperson, call your senator, tell them this is important. You need these things without them knowing, without us saying anything. I think it's the only way we can get our voices heard is to advocate for ourselves. Next slide. So again, here are some places where you go for financial services, financial resources, whether they be in-house with HealthTree. But there is a Conquer magazine you may be aware of. Conquer magazine is a patient resource guide that comes out every year that updates a lot of information regarding the drugs per cancer, not just blood cancers, but they have other cancers in there as well. You can also Google resources support for your specific disease, but make sure to vet any organization before giving out any personal information. Please, there are people out there who are trying to get your personal information, and your medical information can be stolen. People have reported having gotten their EOBs or getting bills for treatment they never received because somebody has stolen their information. So be aware of all of that. We do have financial coaches that not only coach myeloma, but they coach other blood cancers. They will coach CLL for you as well. Call our ask for a coach, and you can be referred over to them. If you have a fairly complex question regarding Medicare, timing of Social Security disability, or all those things, I am readily available. Ask for me as a coach, and I will be glad to reach out to you. We have financial resources for pharmaceuticals, and you have your resource now for your pharmaceutical things on this webinar. But for other resources for travel, for whether it's in-state or there's private jets that people have also been able to get access to if you have treatment out of state. There's for utilities, for mortgage, for food, for lodging, for childcare. There are a lot of resources available, even for cleaning your house should you need it. But we have a lot of those financial resources online at our go to our, I think it's coach or resource educational. You'll see, or on the front page, financial resources on the landing page. You can go to those and get access to those things. Next slide. So in summary, your best financial foundation is to make sure you have the best coverage. That means insurance through your insurance company. This should be checked annually and throughout the year. Then put together a budget. Make sure you ask your doctor what changes may happen with treatment in the near future. Ask up front about all costs for treatment, including labs, scans, medications, doctor's visits, etc. Keep a record of everything, including approvals for assistance, because you may need that in the event you need to file an appeal or use that to get your assistance approved. Be aware of surprise changes mid-year to Medicare Advantage plans and Medicare Part D standalone plans. Check for generics if possible, because generally they're somewhat cheaper. Refer to healthtree.org at financial coach to get a financial coach to assist you for any of your financial questions. I think that's it.
Yep, that was wonderful and so incredibly informative on a super important topic. So thank you. We are now in the Q&A portion of today's presentation. I know we've got a couple questions in already, but if you have any questions, feel free to use that little chat or Q&A button and ask those there, and I'll go ahead and read them off. So first question here is, I contacted my insurance company to find out if a targeted drug for CLL would be covered or not. This would be something I might take in the future. They said that the drug needed prior approval and the doctor would need to prescribe it before I can find out if it was covered. What is the recommended way to find out this information? I feel like I didn't follow the correct procedure.
Wow. Generally, if you have a plan, you can call or you can get on your on if you're on Medicare, you can go on their Medicare.gov and go into their insurance plans, and they will be able to tell you, and you can put in the one that you have, or you can talk to a broker or go through your state and health insurance program. There are people there who can help you. Tell them what insurance you have and ask or what you're thinking about. You don't even tell them what you have. And tell them, I want to know if this is covered under this particular insurance plan. You can get the insurance and information out there before prior approval. If you need a prior approval, of course, your doctor has to do that. If it's one of the drugs that are not on formulary, he will let them know that it's medically necessary. He may have to do a peer-to-peer review, and usually that's the fastest way to get it done. If you're going off treatment, a lot of times you can make it have that appeal done as urgent, and I think it's no more than 72 hours to get that approval or answer back to you. But the doctor would say it's medically necessary. Peer-to-peer reviews are generally very, very successful.
That's very good to know. And kind of along those same lines, you brought up clinical nurse navigators. And I just want to let everyone know, because I feel like it's not something that everyone knows about, but they are a tremendous resource for patients. They will help you kind of go to battle with these insurance companies. So take advantage of your resources, not just the financial resources, but if you have questions, your doctor, your nursing team, all of them will be on your side and try to get these things covered for you. Everyone wants
Exactly.
to see the best for you.
Exactly. Know your whole provider team, and they may have different names in different hospitals, and they may have different responsibilities, or they have cross responsibilities. But there's going to be someone there who's going to be able to help you, tell you they're familiar with the insurances, right? They're taking insurance from people all the time. They should be able to tell you if you're there at the hospital, if they've had problems with people getting covered for that particular medications, and how they're able to navigate that whole situation.
So, and then another question that I know comes up pretty frequently is CLL. A lot of people are on watch and wait, or they might be on one treatment for a while and then they need to switch to something different. What happens if mid-year you end up on a treatment that may not be covered? Is
Again,
there, go ahead.
that's where you're going to have the doctor do that medically necessary, because your treatment, your body changes thing. You may come out of remission. You may need a different medications. That is when it's medically necessary, and that insurance plan you have may not cover it. You're expecting it to cover. You're expecting to stay on the same treatment. That's when the doctor's going to say medically necessary. He'll do appeal through your insurance company.
So, all right. And think I think you did a really good job of covering pretty much everything. We're not having too many more questions here, but I think you were super thorough and covered pretty much everything that people are wanting to know anyways. So thank you for this presentation and for your time. This is such an important topic. And again, Diana is available. She is a financial coach here at HealthTree. If you have questions, feel free to reach out to us and we can get you in contact with our financial coaches who will help. These are people who understand the system a little bit better and have worked through it. And they're here to help you get the assistance that you need. So don't hesitate to reach out if you have questions for us. That is why we're here.
And I would also encourage everybody to join the Financial Connection group, because that's where you're going to get your latest information, the most important information that's relevant to you as a cancer patient.
Absolutely. That group is pretty active and a really good resource. So, well,
Thank you all.
yeah, thank you. And then, all right, as you leave today's session, again, I want to let you know about the survey that we have. If you take a moment to fill it out, that does really help us. And I want to let you know about a couple of events that we have coming up. So, um, on May 22nd, we're going to be doing a diet and exercise to combat CLL fatigue. This will be with Dr. Alessandra Ferrajoli from MD Anderson. So that'll be a really good event. And then on May 28th, so about a week after, we have Understanding the Risk of Secondary Cancers for CLL Patients with Dr. Brian Hill. So both of these are really big questions and really good topics that I know the community is interested in. So if you are interested in either of those, I highly recommend that you register for them and check them out because I think they'll be super informative. We do also have a podcast out about what are BTK degraders. This is a new line of therapies that is being developed. They're in clinical trials right now, and this provides a really good glimpse into what's on the horizon for CLL. And then again, special thank you to AbbVie. We wouldn't be able to host these types of events without their support, so really appreciate them. And finally, I just want to thank you to everyone for joining us today. Even if you weren't able to attend live, thank you for registering. We love having people as part of this community, and we're here to support you in any way that we can. Big thank you to Diana, not just for this presentation, but for all the work that you do. Truly, you are such an asset to have. And if anyone has any questions or any feedback or anything along those lines, or even if you just want to chat about your experience, my email's up on the screen here. Feel free to reach out to me at any time. I'm always available, and I love having an opportunity to connect with and meet members of the community. But with that, we're gonna call it a day, and I hope to see you at another event soon.